Most diabetics, when they tell me their story, basically they go in for blood, could be a normal visit with their doctor, a life insurance check, what have you. They go in, doctor runs some blood, they get a call 2-3 days later from the office and they say, hey, Mr. Jones, doctor wants to see you. You go back into the office. The doctor says, hey, we ran your blood and I'm sorry to inform you, you're a type 2 diabetic. And I'm told before the doctor clicks his ink pen and rips off the prescription sheet that you get your first medication. And typically this medication is Metformin. And then the doctor gives you what I hear is this awesome advice from the doctor. Listen, you're going to need to take this medication, change your diet, lose weight, and start to exercise. I'll see you again in 6 months. And you go back and you try that, and maybe the medication works temporarily, but eventually your blood sugars start to creep up. Your A1C starts to creep up, and the doctor says, hey, we did your blood work again, and we need to make a change. And what does a change mean? Another medication. And so you get another medication, and this type of action happens month after month, year after year, of you talking with your doctor. And eventually then you get put on a statin for high cholesterol, you get put on a high blood pressure medication. We call this the diabetic cocktail. Sometimes you're having trouble with your liver. Sometimes you're having trouble with your kidneys. You might have eye issues, male issues, whatever the case may be. But eventually, the doctor says, listen, we've tried all the oral medications we can try, and eventually we're going to have to put you on insulin. And if you didn't know, insulin's one of the most invasive, the most common, and the most strong fat-storing hormone that there is. And so you go down this road year after year, you have no idea what makes your blood sugar go up. You have no idea what makes it go down. And the reason is no one is checking why your blood sugar is rising. No one's checking underneath the surface, or what I like to call underneath the iceberg. You must check. It could be numerous different things. You could have a problem with your liver, something called fatty liver. Your gut, you could have something called leaky gut. You might have a problem with your adrenal glands. You might have a problem with your thyroid. All of these things are extremely important in terms of your body's ability to regulate the blood sugar, which is a very common, basic physiologic function that you need to do to live.